What not to eat when you are pregnant. You are pregnant. The minute you hear those words, all kinds of thoughts start running through your mind, and one of the main ones is what to eat and what not to eat when you are pregnant. After all, you want to make sure your baby is healthy and that you remain healthy. It is important that you avoid foods that high in mercury. Fish are high in protein and omega-3 fatty acids, but mercury is a very real concern, especially for your fetus. Too much mercury has the potential to damage the nervous system of your baby. The FDA and DPA recommend avoiding shark, swordfish, king mackerel, and tilefish. The FDA and DPA say that 8 to 12 ounces of any of the following seafood are fine for pregnant women to eat. This includes shrimp, crab, tuna, salmon, catfish, tilapia, pollock and cod. Different doctors have their own idea of what is safe, so talk to your doctor before eating seafood during your pregnancy. A pregnant woman should always avoid undercooked meat, eggs and poultry. When you are pregnant, you are at risk of bacterial food poisoning. To prevent foodborne illness, make sure the meat you eat is completely cooked. Use a meat thermometer to ensure it is cooked. You should always cook hot dogs and processed meats until they are steaming hot to avoid illnesses such as listeriosis. It's even better if you avoid completely. Do not buy raw poultry that is already stuffed, as this can cause bacteria to grow. If you choose to buy these types of products, make sure they are thoroughly cooked. Pregnant women should avoid unpasteurized milk, brie, feta, blue cheese, camembert, or Mexican cheese, as all of these can lead to foodborne illness. Eggs should be pasteurized and not fresh, as there is also a risk of bacteria. When you are not pregnant, the majority of these foods do not pose a risk. However, to your unborn baby, a bacterial infection or food poisoning can be life-threatening. As a result, the FDA, EPA, and most doctors recommend that you avoid any food that is considered high risk. It is a good idea to speak with your doctor, whom you trust, about what is right for you. Eating a healthy diet is important to your health during your pregnancy, and to your baby's health. For more information, click link below.